With Easy to Pass NCLEX, easytopassnclex.com. If you are with me today, you will be hearing about myocardial infarction, MI in a short term. And also in layman's term, we do say heart attack. Okay. So what is myocardial infarction? First of all, we know it's an emergency. It's a cardiac emergency, and that we must act fast to identify it and treat it, as such. So what is the path of myocardial infarction? So it could basically mean something basic as lack of blood flow or lack of oxygen to any part of the cardiac tissue itself. It can be also a result from drugs. It can be also from something as basic as the heart, failure, as a chronic, condition. So anything that stops or prevents or reduces blood flow to the heart. If we're reducing blood flow to the heart, we're also reducing oxygen to the heart. And this is what can cause myocardial infarction. Okay, so what would be signs and symptoms if somebody is suffering or experiencing myocardial infarction? These are the signs and symptoms that you're going to be identifying. Chest pain or tightness. That's a classic symptom for myocardial infarction. Okay, but also note that not everyone may report these symptoms, such as the chest pain, especially people with nerve issues or people with diabetes who may have reduced perception based on nerve problems. Okay, also fatigue is a big one. Anxiety, sense of impending doom, that would increase the anxiety, which also in turn increases oxygen demand to the heart. Decreased perfusion, we already mentioned that, which can be also one of the main reasons why the myocardial infarction is happening in the first place. And then also dysrhythmias. Dysrhythmias can be anywhere from ST elevation to non-ST elevation. And as you follow us, you'll be hearing more details, or I'll make more videos to go in specific details about ST elevation and non-ST elevation myocardial infarction. So now that we've gone over the signs and symptoms, let's look at some tests or basic diagnostic that the nurse should anticipate, if someone is suffering from myocardial infarction. Okay, so you want to assess your cardiac enzymes. What are the cardiac enzymes that are classic for assessment of myocardial infarction? You want to look at your troponins. It could be troponin I's or troponin T's. Okay, you want to look at your CKMB, right? Your creatinine kinase, and also your myoglobin enzymes. You want to look at all these diagnostic studies. You want to look at your CBCs. You also want to look at your ABGs, and you want to look as basic as your EKG findings when someone is suffering from myocardial infarction. Note that time is essential in place of myocardial infarction. Time is really essential because you don't want to delay treatment or care for these clients. Okay. All right. So you also want to look at your coagulations, your PT-INR and your PTT when someone is suffering from myocardial infarction. You want to look at your coagulations as well as you anticipate treatment. So what will be nursing interventions? And when I say nursing interventions, I also want to say priority interventions, because you want to act fast and have better outcomes for your client. So you want to first look at the onset. When did it start, or what has been done since the onset? Okay. Aside that, think of the acronym MONA, M-O-N-A, MONA, basic as that. If you can remember MONA, the acronym stands for morphine. The morphine basically reduces anxiety. It also alleviates the pain and also helps, reduce the pain that the patient is suffering. When you're able to reduce anxiety and pain, also decreases the cardiac oxygen demand. Because remember, when someone is in anxiety or when they panic, they breathe fast, right? And that can increase oxygen demand. So we want to slow that down. That's why we give morphine in MI. The O stands for oxygen in decline, because lack of blood flow or perfusion or oxygen to the tissue is what may have caused the cardiac injury to begin with. So anticipate oxygen to help, supply oxygenation to the client. The N stands for nitroglycerin or nitrate. What does that do? That's a vasodilator. So it dilates the blood vessels and also reduces oxygen demand and the blood flow for the cardiac needs. Okay, so also it reduces the cardiac workload, such as the preload and the afterload. So that's how when you vasodilate the client, it will help alleviate, that as well. And aspirin. Aspirin also works directly on the platelets to prevent or stop clotting, which can also increase blood flow to the cardiac muscle. Okay, so Mona, those are the classic treatments for myocardial infarction.